Americans are working harder, exercising less, and getting more and more stressed. That is a recipe for pain, back pain.
That's right. 50 million Americans have some kind of back pain. 80% of people over 55 have it. As this area has one of the oldest populations in the country, that means a lot of local people complain about their aching backs. Well, tonight, Channel 4 Action News anchor Sally Wiggin joins us and tells us some of it may be in our heads. Is that right?
Yeah, of course, Andrew. It's in your head because the brain controls pain. And your stress, your repressed emotions also come from that brain. So it makes perfect sense for many back patients. Control the stress, control the pain. But it's not quite that simple.
How are you feeling?
I feel great.
Good. Any leg pain?
Nothing. My pain is gone.
Betsy Linarelli's back pain was excruciating. Nothing had worked for the registered nurse. Not physical therapy, electrical stimulation, or massage. Then an MRI showed a ruptured disc, and she visited neurosurgeon Don Whiting.
I saw him on a Friday. He said, "We can schedule you Monday." I said, "Thank you."
Whiting operated on Betsy because her neurological function was compromised, leading to unresolved pain.
People with back and neck pain, the majority of those people have muscular-mediated pain, and much of the time that muscular-mediated pain is either from stress, anxiety, or sometimes deconditioning. And resolving those issues resolves the problem without any type of surgery.
Mind-body connections have become an accepted part of pain treatment. Dr. John Sarno of NYU School of Medicine even wrote a book, Healing Back Pain, about his belief that most back pain arises from repressed emotions. And Nancy Kennedy, a clinical psychologist at Allegheny General, admits it is easier for some people to deal with physical pain than their own emotions.
As a matter of fact, some folks, whenever their neurologist or neurosurgeon suggests that they seek psychological treatment, are insulted by that idea because they believe that to assume that psychological treatment is necessary means that their symptoms are make-believe, when in fact the symptoms are very real. Besides psychotherapy, non-surgical treatments can vary depending on the individual. Biofeedback, yoga, meditation, and acupressure can combine with procedures like flexibility and strength training. At the pain program at UPMC, Director Dr. Doris Cope and her staff identify certain stress-related pains as fibromyalgia, when muscles tighten and clench and the blood supply to them is shut off. The result? Pain.
If we can teach relaxation exercises, which we do in a fibromyalgia workshop we have, if we can teach them to relax, to deep breathe, to have an alternative response to the clenching, the ischemia, the pain, then they can do better. We can also teach life management skills by showing them what stresses them and how they can make creative ways to avoid that stress.
Kathy Buterbaugh's job is full of stress. She's a triage nurse who has a herniated disc. She and her neurosurgeon have decided to treat it non-surgically, since 80% of the time, herniations get better with non-surgical treatment. But there is intermittent pain.
You have to take a few minutes and go have a breather. Take that a mental health moment, as we all know we have to have. But that helps with the pain control because you have to, with the more stress that you have, the more intense the pain can become.
And remember Betsy? Sure, surgery took care of her acute pain, but before that, she had suffered from chronic muscular back pain for 20 years. Now it's up to her to keep the pain at bay.
I need to be ultra careful not to re-injure myself. I need to just keep exercising, keep flexible. I'm typically not a stressful person, so.
So you're not worried about that part?
Not at all, not at all.
Well, she's lucky because some of us are. The physicians to whom I talk believe that our lives are far too stress-prone, and that exacerbates any kind of pain, especially back pain. So things like progressive relaxation and yoga really do work. But alternative treatments are not the only answer for back pain. Physicians often use a combination of injections, anti-inflammatory meds, and stress and emotional management.
Well, Sally, interesting story. You mentioned getting rid of the mental stress helps, obviously. But what about the physical stress, things like being overweight or out of shape?
Obviously, I mean, if you are overweight, you're not going to be able to strengthen your core muscles or your hips or your legs, which protects your back. And so it's, one of the doctors, Dr. Whiting, the neurosurgeon, said maybe the gas shortage will help us because we'll be forced to walk. And that's really good for your back, is walking. So, you know.
I'll keep that in mind.
It's all integrative. It's all about complete and total health, here and from the neck down.
Good advice.
Like I do that. He knows I don't.